Does the pull-out method actually work? I'm Dr. Rena, a urologist and pelvic surgeon, and today we're going to answer whether withdrawing, also known as coitus interruptus or pulling out, truly helps prevent pregnancy, and whether there is any sperm present in pre-ejaculate fluid. During arousal, men release a fluid known as pre-ejaculate, or precum. This fluid is produced by glands called the bulbourethral glands, and it serves several purposes. First, it helps lubricate the pathway so sperm can travel more easily. It also helps semen thicken properly, or coagulate. And finally, it protects sperm in acidic environments. Both urine and the vagina are acidic, so this fluid helps keep sperm healthy enough to reach the egg without being damaged, allowing fertilization to occur. Now that may sound reassuring, but there are two important things to understand. First, you cannot control when pre-ejaculate is released or how much comes out. This varies from person to person. Some may release just a few drops, while others may release up to a teaspoon. Second, and more importantly, does this fluid actually contain sperm that could lead to pregnancy? The short answer is no. The fluid itself does not contain sperm. However, if you have recently ejaculated or had sex, sperm may still remain in the urethra, which is the passage this fluid travels through. As a result, pre-ejaculate can pick up those leftover sperm and carry them into the vagina, potentially causing pregnancy. Another challenge is that it can be very difficult to withdraw at exactly the right moment, which also increases the risk of an unintended pregnancy. So how often does pregnancy happen with the pull-out method? Researchers reviewed surveys from over 2,000 women and found that nearly 1/3 reported using this method for birth control. Among those, about 21% experienced an unintended pregnancy despite using withdrawal. Overall, it's estimated that somewhere between 9% and 48% of people rely on this method. So, should you use it? There are a couple of key points to consider. First, it does have a relatively high failure rate, meaning there is a real chance of unintended pregnancy. Second, and even more important, it offers no protection against sexually transmitted infections. Studies have even detected HIV in the pre-ejaculate fluid of infected individuals. Because of this, using a barrier method is a much safer choice if you're concerned about STIs. Additionally, there are many safe and effective birth control options available through obstetricians and gynecologists that can help prevent unwanted pregnancies. These methods are far more reliable and safer compared to relying on the pull-out method. I hope this video answered your questions. If you enjoy my content, please be sure to subscribe and share this channel with your friends so we can spread helpful knowledge far and wide. As always, take good care of yourself because you truly matter.